All right. Hello, everybody. Hope you can hear me okay. All right. Well, thank you so much for joining me in my presentation today. I hope you enjoy it and find it informative. I know this isn't a really popular topic sometimes in general practice, but a lot of these instances do occur. So hopefully this will get you more informed so you know what to do in situations on your own, and then also how to help clients that call about wildlife as well. So let's get started. Okay, so we can start with what is wildlife rehabilitation as a whole. So wildlife rehabilitation is the treatment and care of a sick, injured, or orphaned wild animal, and it's preparation for release to a successful life back into the wild. So that's our main goal. As a wildlife rehabilitator, your goal is going to be to return all wildlife to their ecosystems so that they can continue to play their roles. So wildlife rehabilitation essentially is very important for endangered species. It's huge. So that without wildlife rehabbers, we wouldn't be able to help those species that need it. So that's a great opportunity. All right. So this is an example of a release of a young swan. This is actually footage from my, I call her my mentor. So Michelle LaBelle, she is also a licensed wildlife rehabilitator, and there are 3 different classes. So I am in the first class, which is the novice class, and she is what you consider her a master. So she just got that certification. So that's huge. But this is an example. She took in this young swan and it had a foot injury. So what was really cool about this situation is you are being able to release it back to its actual family. So this is why record keeping and paperwork and details are so important in a situation like this. So let me get this started here for you. So happy. Okay. All right, so I'm sorry about that. I thought I'd be able to play just from the screen. So without having to do that again, I'll explain this next picture. So I explained the cool thing about the swan. So we were able to track that family and keep track of the family. So we were able to release that swan back with its original family. So that's huge and very important. With this situation, so you can kind of see him there. That is a ground squirrel. So he actually, I put this in for fun because it's, you actually hold it open there and he stares at you for a second. And then he's like, he goes back to the end of the back of the kennel and he's like, nope, I'm good. I don't want to go. I don't want to go. I'm fine. That actually happens a lot. There's been a couple of squirrel releases that we've done where they actually don't leave their kennel for quite a while because they're scared, they're nervous. They're like, this is a big, scary world. I haven't been out here a long time. So not always when you go to release an animal will it leave. But I mean, it's just sometimes may take a little bit longer than expected. So this was just an example here with the ground squirrel. So I'm sorry that's not playing for you. All right. Oh, thank you. Oh, all right. Okay, so what to expect when you're not expecting to end up having a wild animal come into your clinic. So many of the wild creatures that come into wildlife rehabilitators' care, a lot of times were first brought to a veterinary hospital, and these aren't going to be your typical patients. Obviously, you're dealing with a lot of different species too, which you do in general practice as well, but this is obviously different. So clients sometimes will just call for advice or bring in whatever animal they may find in their backyard. in need of assistance, or maybe it doesn't need assistance. So you can help them kind of differentiate when they need to intervene and when not to. So what to do next? You're going to be dealing with, oh, thank you. You want to make sure that this is something that you really drive home with people who are calling. So you don't want to give people advice on how to raise wildlife at all. Often a finder will call a veterinarian's office to find out like how to raise a wild infant. What do I do? What do I feed this animal in, in regards to keeping the animal? And you don't want to do that. You don't want to give out any information that would make a person feel like they're qualified to raise an infant. If it's something where you want them to help a situation or prior to transfer, you can definitely advise them on what to do next. If callers have wildlife in their possession, you want to make sure they bring the animal to a rehabilitator right away, or you. Obviously, you're able to do this as well. And hopefully the information I give to you today will help you know what to do in those first few hours or days that you may have that animal in your care. So here's a fun little example. So this is something a lot of people are going to call you about, like I mentioned, where baby animals that they see that they're in their yard, or they see them on, they're out on a walk, and they may see them and they think, oh my gosh, I need to save them. They're alone. This is not always the case. So some examples here in this little comic is showing a deer. So this is very, very common. So deer are left for long periods of time during the day. Mom is off and she's eating, she's taking care of herself, and she's got her baby tucked away somewhere very, very safe. And she probably really, she knows where they are, and I promise she's taking care of them. Same thing with rabbits. So the mom will come to the nest, usually 2 to 3 times a day. That's it, for feeding and just kind of checking on, how are you doing? But for the most part, because rabbits are they have so many predators, they're always scared. They're always going to run away. They have to be very cautious. So going to that nest infrequently is very important for them. The calls about your young birds, so your fledglings. So they're like, there's a bird, it's out of its nest, it's flapping around, it can't fly. This may happen. They're awkward. It's normal. They're going to flap around. They're not really sure where to go. You may see mom, especially a crow, up in a tree nearby. Trust me, she is watching her baby and she's going to get very mad at you if you touch her baby. But they'll stay on the ground for quite a few days actually. So as long as they're not in the middle of the road, please leave them alone as well. Also same thing with fox kits. If they're alone and like playing around their den, that's totally normal. Mom's out and she's hunting and she's doing the same thing. So sometimes all you need to do to help the babies is just kind of leave them alone. If you, again, are concerned for their well-being, if they seem distressed, if they're cold, if they seem like they're very dehydrated and just they're not reacting to you at all, sometimes you have to be cautious about that too. But make sure to call a wildlife rehabilitator just to specify and make sure you're doing the right thing before you're grabbing something that you're not sure what to do with. So that's that. So transportation. So this is huge. You're always going to want to wear gloves. It just depends on what kind of gloves, given the situation. So are you just going to wear exam gloves because you don't want your scent on the animal, or is it something where this animal has talons and you need gloves for your safety to protect yourself? So just make sure you know what kind of gloves. So use a kennel or properly sized container that you can secure safely. I want to reiterate, secure safely. You don't want things getting away in your vehicle. This is very, very dangerous and it's not a fun experience. Make sure, depending on the situation, that there's air holes available. If it's not a kennel, you want to make sure that they have a way to breathe. So if it's a closed container, maybe leave it cracked for the best of your ability to keep it safe. If it's a small non-rabies vector animals like a squirrel, you can place a towel with no holes, rips, or long tassels over the animal, gently pick them up and put them in the container. Larger animals, so if you're getting an injured animal that you're not really sure about off the side of the road that has not passed away and you're looking for help or what to do, especially with your raccoons and things like that, you don't want to necessarily touch them. So if you can use an object in your car, A lot of times you can use, you know, your ice scraper. We have those available all the time, something like that, and something that you can just nudge and slide them into the container and then flip them over safely and get them into your car. And even if they might be on death's door, they still can come to when they feel like they need to get away. So make sure you're prepared for this as well. Also placing a towel in the container with the animal to help reduce stress during transport is helpful too. Just make sure it's something safe that they can't get stuck or tangled in. If it's an animal that can cause you physical harm, so what I talked about with the gloves. So good examples are herons and loons, swans, fox for obvious reasons. With the herons and loons and swan, so you're talking their wings, their beak, and their talons as well. You have to be very, very cautious of this. Don't attempt a rescue mission alone. A lot of the times, it takes a real big group to rescue something, especially the waterfowl, especially the geese. Even if they are injured or if they are sick due to ingesting a poison or something like that, and they don't have the ability to fly, they can still try really hard to get away, and you're going to need help. You can call your city's non-emergency police number, ask for assistance, obviously. You can also refer to the list provided on the DNR website. So they have local permitted wildlife rehabilitators in the area that will be able to either help, or if they can't, they can advise who can come to help you as well, which is important. So here are some examples. So a goose in a kennel is a very easy and safe way to transport them. Trying to get them in that kennel sometimes is ridiculous. I myself sometimes have not been able to get them in the kennel because, let's say, the kennel in my car is too small, and I'm like, okay, well, this isn't going to work. If you can try your best, even to the example on the other picture here, if you can get their wings close to their body at least, that's really going to deter them from being able to flap around in your car. And once they start flapping around in your car, it doesn't go well from there. I have had plenty of experiences where I find myself without a kennel and trying to figure out how to get this goose to not poop all over my car and fly all over the car as I'm trying to get it to safety. This picture too is a really good example. So if you're watching a Canadian goose or another type of waterfowl that, let's say, has an injury, but it's getting along okay, and you notice this in the fall, and they've got all their friends and they're all hanging out and everything's fine, but that one goose looks weird. If you watch it until winter, when the ice freezes over here, if he stays, he needs your assistance for sure. You can definitely call somebody to help, and then even participate in the rescue yourself, because obviously you can see from the picture, there's going to be multiple people that are involved in something like this. It's actually easier to rescue a goose from a frozen pond than from an open pond. Otherwise, you're dealing with a lot more people and a lot more floating devices, which sometimes it's still unsuccessful. But with the ice, you need to be very, very, very careful of yourself too. So just make sure you're not doing these things alone and you're not making these decisions alone. You want to ensure that you're safe and anyone helping you is safe as well. So really good example there. This is a really cute video that I want to get to play that of course is on YouTube. So I'm going to try really hard to get this to work again, and hopefully it won't be awful. Unplug that. Okay.
They make something restrictive, like almost like a dog harness that goes over the legs, so they have limited movements or something.
So what are you doing? Perfect. Okay. Thank you for bearing with me there too. So that was a good example. So you've got your two fox pits here in the kennel. They're obviously contained safely. One is obviously more critical than the other, which is very obvious. I chose that video too. That I love the sound of fox. It's just one of my favorite noises. So what's nice about this too, you've got a sheet. It's clean. It doesn't have any holes, rips, things like that. And you've got some, obviously there's branches in there. So you're trying to mimic the natural habitat there and give them something to reduce your stress for them. So something familiar is really important for them as well. You can tell that the one box is obviously more stressed than the other. Again, that has to do with how critical one is versus the other. But they're housed together because that also reduces stress. Being with their own species is very helpful in these instances. So think about that too. If you are transporting or advising someone on transporting, if there's multiple of a litter or group, make sure to keep them together. They're going to be less stressed this way. Oh, okay. So questions that your clinic may have. This is something that Michelle, who is my mentor, wanted me to drive home to you guys. So this is very important because a lot of people in veterinary clinics are like, I can't treat this. I don't know how. I'm not licensed to. So these questions are right out of this was actually questions off my test that I took for my licensing. So you can see the question down here. A veterinarian who has agreed to assist and advise a permitted wildlife rehabilitator must also possess a wildlife rehabilitation permit. This is false. So a permit is required only if an animal is kept at the veterinary clinic or office for greater than 48 hours. So in that 48-hour period, there's a lot of things that you guys can do and help. And we as rehabilitators think this is huge, and just the more knowledge you guys have, and the easier it's going to be for us when we get them, and they'll be less critical because you guys have really taken a big part in taking care of that. So that's huge. So the next question here. So veterinarians are not required to have a DNR wildlife rehabilitation permit to consult with rehabilitation permit holders, to advise permittees on care and treatment of animals, or to undertake various treatments of animals undergoing rehabilitation. So this is true. So in addition to not needing a permit to advise rehabilitators on wild animals, veterinarians may treat animals in their office or clinic without possessing a DNR wildlife permit. And like I previously mentioned, provide the animals care for up to 48 hours. That's 2 days. That's huge. So we in Minnesota have great resources, and usually this isn't something that we need to do, but you never know, given the circumstances and the world we live in today. Sometimes you may be stuck with something for a couple of days. So it's really important to know what you can and cannot do legally, and then some of the best measures that you can take as well. So paperwork, yes, this is huge. And this is true for wildlife as well, just like in general practice. So things that you're gonna want on these forms, obvious things like name, address, and phone number of the finder. And this is gonna be huge so that the rehabber can contact them if they have more questions. So where the animal's found, also huge. We wanna make sure that we return them to where they were found, or as close as possible, as long as it's a safe area. If the animal is an infant, does the finder have any idea what happened to the mom? Did she die? Are you sure? When was the animal found? What happened since then? Has anything been provided? Sometimes people try their best and they'll offer whole milk, which is not a great idea, but they're trying. But this is good information to know. So who has handled the animal? How often? Were gloves worn? This is really important to ask about mammals, especially about rabies and different types of zoonotic diseases that we really have to be cautious about, especially in raccoons, in case of this word that I cannot pronounce to save my life, but it's raccoon roundworm. Doesn't affect them, but it affects humans, and you have to be very, very careful of this. Is there any possibility that a cat injured the animal? So this is huge because we want to be able to provide treatment immediately with antibiotics. Try to determine whether you can return the healthy infant to the parent. So this is where it comes down to talking to the person and getting those really, those details, figuring out, was the animal at the bottom of a tree? Did it actually seem like it was in distress? Or maybe, mom just stepped away for a second. We have to really determine this because their best survival rate is going to be with their mom. So this is important. Squirrels. I love squirrels. So all the details, you need all the details. This is very important. So first and foremost, you want to worry about physical exams. So when they come in, This is something that you and your doctor can do together, because this is not something that you guys are familiar with. So it's really good to do this together so that if one of you is missing something, maybe the other one catches it and vice versa. And it's really, you got to be careful. They're unexpected when it comes to reactions, because you're a predator. You're a huge predator. You smell weird, you look funny, and you are definitely not what this animal is expecting, even though you're trying to help. They don't know. So a lot of times it's instinctual for them to just lay there and just be in complete shock. The animal may actually experience tremendous stress just by being held captive, can cause enough stress to be life-threatening. So small birds, rabbits, they can literally die of fright. And if you work in a mixed practice where you do see exotics, you know this firsthand. Same in wildlife. You should start a visual exam as soon as possible. So in the event you get an animal brought into the clinic, or you yourself find an animal, make sure you're taking the time to put them in a dark, warm, and quiet place. You want to make sure that the stress that they've endured from being brought to you, or whatever the situation may be, that they take time to calm down, because otherwise what you're going to see is just their stress, and they're not going to actually show you what's wrong with them. Obviously, the visible wounds and breaks are going to be quite obvious. Those are a little bit different, but again, can wait, because stress alone can just kill them. Can they stand? Can they walk? All limbs, are they in the right positions? Does the animal seem dazed or dehydrated, malnourished, or weak? A lot of these things you just can do by looking. And if it's best, even if they can't even tell that you're looking at them. There's a picture at the bottom here. This is a baby squirrel. And you can see by just glancing at this, I'm sorry if that's pretty small there for you, but those bruises, that is going to indicate trauma. So even though the skin's not broken, you have to be concerned about internal damage there. So be very cautious. Obviously, this squirrel doesn't look like it's in any condition to hurt you, but just in your treatment, and know that this may not go well. And preparing yourself for that is really important too. So go slow. So if it's something where the animals calm down and you really have to get your hands on this patient to figure out what's going on, just slow, very, very slow. Speak softly. Keep movements, noise, and especially talking to a minimum. Just observing. When you're working with wildlife too, make sure that you're trying to avoid strong smelling soaps, perfumes, things like that, because those smells are super stressful to them as well. Things that maybe we wouldn't think of, but like cold metal exam tables, that's super stressful to them during exams. So even doing just like a soft cloth on the table first, that's really, really helpful to minimize stress. And a lot of times, taking out that visual aspect, or even covering their eyes, or even trying to do cotton balls in the ears, will really help too. And one of the biggest things that you can do that'll be really helpful to further the treatment for the animal is going to be to weigh them. So we can figure out what to do for fluids and medications. So you can see a picture right there as an example, getting a weight, and I'm sorry, that's blocking some of the words there for you. So dehydration and rehydration. So you can assume that any wild infant that's brought to you is suffering from some degree of dehydration. And this can be true too with an adult that could be injured. Obviously, with any kind of wound, we're going to worry about that too. Make sure that you're treating with warm rehydrating fluid. So LRS, your Pedialyte, whatever commercial rehydrating fluids you have in stock there. If the animal is willing to accept oral rehydration, this is going to be your best choice, since it will help to keep restraint stress levels down. So less handling that you can endure with them is going to be best for them. If the animal resists taking fluids by mouth, which is super typical, they're going to struggle, they're going to freak out. Give them a break, and then just doing a simple bolus of sub-Q fluids is going to be the most common way to rehydrate in most mammals, and then even some birds, if you're comfortable too. And obviously your doctor is going to help you with dosages for that. Like I said, their rehydration protocols are the same as those used for domestic animals. So warm the animal and the fluids before administrating. This is super important. We know this too. Obviously in veterinary medicine, you want to make sure that your fluids are warm and your pet is warm, this is huge for shock. And there's a cute little example of some baby fawns there, obviously feeding themselves. So very stress-free there. So fluids continued. So this is huge. So once the animal is rehydrated, you want to start introducing formula, but this needs to be done super gradually, especially with some species. Their GI systems are super critical and they're hard to keep happy, especially baby bunnies. This is the hardest thing I've ever done in my whole life. But when it comes to doing this gradually with your fluids, you want to, there's a formulary there. So 1/4 formula to 3/4 rehydration fluid for a feeding or two. And then you want to move to half and half, and then 3/4 to 1/4, and so on. And then finally use the full strength formula. So you may not get to that step. You'll probably end up transferring before that happens, but it's just good to know the need. And this is obviously, this is true if we change a diet in our own animals. So this is this comes naturally to us. And this is something that hopefully you can explain to someone over the phone too, if they're not able to transfer an animal right away. So wildlife nutrition experts recommend the use of like puppy or kitten milk replacers. So no human milk, or cow milk, I should say. Some formulas are designated for specific species as well. Something that I use more often than the puppy or kitten milk replacers is goat's milk. Super good for the digestive system, very easy, and it can be used for so many things, so many mammals. So it's really easy to have on hand. I have the powdered stuff at home, so it's in the freezer, can last about 6 months, and then use it as needed. So it's really helpful. But that's usually something you won't have in clinic. So having a kitten or a puppy replacement is totally fine. This is important. So be sure to let the rehabilitator know, whoever takes over this animal that you've been caring for, let them know the details of what you have been feeding, and that they can do a gradual transition. So if you've been feeding Escalac, I want to know that, because if I have just goat's milk at home, I want to make sure I'm making a transition so that I'm not shocking that GI system. So formulas for some of the species are much more complicated, and can change according to the age of the animal being fed too. So this is huge and important, and I could probably talk about this all day. So I'm trying to make this brief. So if the animal needs to be at your facility for extended care, make sure you're just consulting a rehabilitator if need be, just so that we can help them in that state of need and then be able to transfer them and give that right information. So this is another video. It's adorable, and but I won't take the time to play it for you. So this is just an example. This is feeding of a baby raccoon, and they are adorable, and they make the best noises in the world too. So you'll have to YouTube it yourself. They suckle great typically. A lot of the times, if they're not about it right away, a lot of times you can trick them and put honey on the nipple, and then they're like, this is amazing, and it's all better. Because obviously a commercial nipple or bottle is not going to be the same as mom. So you're going to try your best to try and make that as appealing to them as possible. And sometimes that's hard. And it's discouraging too, because you're like, you're hungry, why won't you eat? But doing things like that is really, just small little things can help too. All right, so eliminations, this is huge. So wild mammal infants with their eyes closed have to be stimulated to urinate and defecate. Some recommend to do it prior to feeding. Some recommend to do it after. I do it before and after just in case, because sometimes I'll get nothing before and think, oh, everything's cool, I'll feed them and it's fine. But then I'll do it after as well, and all of a sudden they have to pee. And you're like, okay, cool, it's been 3 minutes. But just make sure you're doing it before and after. It's huge and very important, because typically they can't do this on their own. You want to use like a soft tissue, cotton ball, make sure it's a little damp, make sure it's a little warm, and you're going to want to stimulate that area so that it stimulates that reflex. It normally allows the parent to initiate elimination and then remove that infant from the nest before it soils the bedding. So they do this. This is planned for them. They make sure to keep everything clean, and they know when they're going to do this. This has to be done even if there are signs of eliminations in the bedding or wherever the animal's being kept. If you're like, oh, it looks like he peed, that you have to do it. You have to do it. It's very important. You want to make sure just in case, because sometimes they may be in the process of getting close to being weaned. So they will be able to do this on their own. But for them to actually completely empty their bladder or whatever it may be, you want to make sure that you're doing it too. And just use like rapid but gentle strokes just to stimulate, like, the mother would if she was like doing it in the wild, obviously. Not the most glamorous thing in the whole world, but it's definitely a huge, huge part and very important in those first 48 hours. Okay, so overnight hold. So this may happen if, let's say, you've got a client that calls and they're like, I found this bundle of baby bunnies. I know the mom's dead. My dog ate it. I don't know what to do with these things. What do I do? This is what you want to make sure that you're following the right steps to keep stress levels down, because that's the one thing, if you're holding on to these animals for an extended period of time, that's what's going to be really crucial for them. So keeping the animal in a secure container, very secure. This is important. So towel, pillowcase, old t-shirt to help reduce stress. Just make sure there's no real strong scents on there. And just make sure that whatever you're putting in there is safe. So make sure it's not something like a huge comforter for this baby squirrel. That's too much. So just make sure it seems appropriate for this size. Place the animal in a room that won't have a lot of human or pet traffic.